Hello, everyone, and welcome to the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the podcast. Today, I am with Dr. Francis Sakita. Dr. Francis is on our faculty and has been for quite a few years. Welcome to the program.
Thank you, Mr. Aebhric.
Tell us a bit about yourself, your background, and what you do.
Yes, my name is Dr. Francis Sakita. I am an emergency physician working at Kilimanjaro Christian Medical Center. This is the hospital in the northern part of Tanzania on the slopes of Mount Kilimanjaro. I've been working there as a specialist for the past 5 years now.
So, Francis, what do you do for the college?
I am the first emergency medicine physician at KCMC, Kilimanjaro Christian Medical Center. And being the first gave me, of course, challenges and opportunities. The challenge is loads of work, being the only specialist, leading junior doctors to be able to provide standard emergency care was, I would say, my biggest challenge, because I had this task of making sure they do the right stuff. They know and do the right stuff through training, sharing knowledge, and the skills that I acquired during my residence program. And that's also gave me an opportunity to role model and to mentor others to like the field and to be able to pursue. So as we speak, I'm no longer the only emergency physician, but there are two more. The opportunity that I'm saying or I mentioned is basically being the first to receive patients and take care of them. And also, emergency medicine gave me an opportunity where I met people of different calibers. And one of them is the person who is interviewing me right now, Mr. Aebhric Kelly. We met basically at the emergency department and we had a conversation. And I remember that was 2018. So that meeting gave me an opportunity to get to know what the college does. And right away, what I was doing as an emergency physician kind of fits in with basically what the college goals are. Teaching or training individuals of different calibers in preparing them to be able to work in remote and offshore medicine. So being a doctor in the tropics, working in areas where I would say you are resource constrained, kind of gave me an opportunity to be able to share with people from different parts of the world who will be or who have joined to come and train in the college, to share my experience as someone who has a vast experience in working in resource constrained areas. So that was the opportunity that I see. So at the college, I work as a faculty or instructor, and that has enabled me to take part in various courses. And one of the examples of the course is tropical medicine, and it's been fun. I've been able to meet various healthcare professionals with various backgrounds or different backgrounds, and it's been wonderful. Yeah, and most of all, I've been able to travel the world, I would say. Because initially I remember tropical medicine course was once held at my hospital, and then from there it was held in Malta. in the Mediterranean Sea. So it gave me an opportunity to travel from Kilimanjaro to Malta. And as we speak, this this podcast is being held in Norway. And basically, we are doing tropical medicine again. So you could see the college, being an instructor in the college, has opened these doors that I'm able to travel and impact or share the knowledge that I have with people from different nationalities.
So you've been to Pretty Bay, Malta a couple times now.
Yes.
For the tropical medicine.
Yes.
Yeah. And this is our first time in Norway, and we're finished with our first week nearly. So how's the experience been teaching tropical medicine to the Norwegians?
Oh, it's been, I would say, wonderful. And the fact that you teach, first of all, it's been like a new experience. What I can say, it's been like a new experience to them, because whatever material that we've been delivering is like, it's like wowing them. You're like, wow, oh, this exists. Oh, and it's like enlightening someone with a very useful information that will kind of left an imprint in their memory and kind of understand what is happening in other people's world, and trying to understand probably what they have and what other people have. So that has been quite good to know on their reaction, that whatever we are doing is not like meaningful, but something that is impacting them and leaving them with solid, memorable things that will help them one day in the course of their work, their profession as soldiers.
Having you here this week has been a profound benefit, because you've been able to give these 21 students the recent experiences you've had in some of these diseases. Francis, you deal with a lot of our students. What can you tell me about what they would experience when they come to your department?
Yeah, so ever since I became an instructor in the College of Remote and Offshore Medicine back in 2018, that gave me an opportunity to be student supervisor, in the sense that whenever they come down to do clinical placement, I'll be supervising their clinical rotation. And for sure, it's been a rewarding experience. Where I work at Kilimanjaro Christian Medical Center, this is a tertiary hospital, tertiary teaching hospital, and the caliber or the amount of patients that we receive there is big, in the sense that you have various patients with various medical conditions that present, and this offers, I would say, this offers the right environment for any student from any from different parts of the world to come and do their clinical placement. And this patient, just to mention, is we have medical patients, of which accounts about 50 to 60% of the patients that we receive. We have trauma patients, fresh trauma patients, and children, though children aren't as many as the adults. However, trauma and medical patients account the most. At KCMC, not only these students, when they come, will be born to just stay at KCMC, at the emergency department, but rather they have this opportunity of visiting other departments. For instance, dermatology department, to learn more about skin problems. They can go to ICU. They can go to a burn unit to spend some time and learn and acquire and see what's being done over there. Talking of burn unit, our burn unit is the first in the region, and the first and only burn unit in the region. So all the burn cases are being brought to us, those severe burn cases. So it's been rewarding, and the feedback has been great in the sense that whoever comes to do clinical placement at KCMC, at the end, they give thumbs up because their expectations are met or were met. Yeah.
The feedback we get from students is always unanimous on the profound experience that you've given them and amount of skills and confidence that you're giving our students is immeasurable. So you are a valued member of our college, and I really look forward to having you and continue helping our students and seeing how things go in the coming future and in the coming years.
Thank you very much, and thank you for having me.
This has been a presentation from the College of Remote and Offshore Medicine Foundation. If you would like to earn CPD credit for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credits, free access to the virtual field guide, and discounts on our e-learning courses. You can join the team on the college website, which is CoROM, CoROM, CoROM.org.